I was first introduced to the product approximately a year ago, got early samples at that point, so I've been using it clinically for a better part of a year at this point. Both direct and indirect, your typical anterior composites, posterior composite restorations, as well as quite a few indirect ceramic inlays, onlays, crowns, things of that nature. Well, when I first looked at the Scotchbond Universal Adhesive, one of the things I wanted to be sure is that I was still getting good bonds with the product, because that's the primary reason I want to use the adhesive is for the retention. Having said that the initial bond strengths look very good for the product, and I'm not worried about that then, I want to look at the clinical workflow and what is the technique to use it. And the real thing that stands out with this product is the fact that regardless if I want to do a self-etch process or a total etch process or even a selective etch process, I can use the same product. So I'm no longer required to hold on to multiple product lines to satisfy a clinical requirement. I can have the one product and then choose how I want to apply it to solve the problem clinically. My patients have not had any post-op sensitivity with the Scotchbond Universal, whether it was in a direct composite or even an indirect ceramic restoration at this point. The instructions are very straightforward, especially when you realize that you have the capability to use it as you would choose. You don't have one guideline. If you would like to use a total etch, if you'd like to use a selective etch, you have that option, and you can then let the clinical case dictate how you'd like to use the product. I would strongly recommend its use to my colleagues. I think anytime we can improve the clinical technique of doing something to minimize the chance for mistakes or errors so we get predictable outcomes, I think that's a very positive thing to look for.